Hi everybody, I'm Trish Christ. NECAT and our super crew of teenagers are here today with Siloam Health. President and CEO Dr. Morgan Wills is going to show and tell us about all the important services they do for our community.
Thanks, Trish, and thank you for joining us. Let's come on in. Let's come and see.
It's our Nashville.
It's Nuestra Nashville.
It's our Nashville.
It's our Nashville.
It's our Nashville.
We all know how to talk about our organization during meetings, but what about the chance encounter of a lifetime? You never know who may share your next elevator, notice your logo on a notebook or a tote bag, and ask what you do. What's the clearest, most persuasive thing you can say in a short elevator ride?
We would hope that our whole person healthcare ministry among the poor and underserved of Nashville would be the catalyst for the flourishing of a whole new Nashville. If you don't have health, you don't have anything. I mentioned the irony that here we are, a healthcare mecca that provides leadership for healthcare businesses around the country and the world, and yet Nashville has, ironically, some of the poorest health indicators for a city of its size in the country. Siloam is uniquely positioned at the intersection of these resources and the need, and anything you can do to partner with us would be a great benefit, not only to this city, but I think as a model for the country.
Lots of things I want to ask you about Siloam, but let's start with a really basic one. Let's talk about purpose. Tell me about the purpose of Siloam Health.
That's easy. Siloam exists to share the love of Christ by serving those in need through healthcare. It was birthed out of a church near Music Row, Belmont Church, back in the late 80s, early 90s, and really the desire of some of those parishioners to bridge Sunday to Monday. They were not paying attention to the pastor one week, passing notes, and decided that they wanted to live out what they were learning on Sunday mornings in a way that made a difference for the real problems in the healthcare given in Nashville to the underserved. So since that time, our function has really been to help plug holes in the safety net and do so in a way that brings whole person care that addresses the deeper factors driving why a lot of patients seek and need health care in the first place.
I saw that phrase, whole person care, a lot in your materials. Tell me what you mean by that.
Well, if you think of our inspiration, Jesus, who gives us the name Siloam, it comes from a story in the Gospel of John, chapter 9. There's a man born blind sitting on the side of the road, and Jesus' disciples ask him, why was he born blind? Was it his sin or his parents?
Wow.
And of course, they're like good medical students. They want to figure out the cause and assign the appropriate blame, perhaps. But Jesus says neither in this case, but this happens so that the work of God might be displayed in his life. And he goes on to restore him, his sight physically, but also reconnects him relationally to his community and ultimately in his life with God. So that sense of physical, emotional, spiritual healing has been part of our DNA from the beginning.
And in that Bible story, Siloam was the pool?
It was the pool where he sent the man to wipe off the mud he had put on his eyes.
Interesting.
Yeah.
So whole person care, physical, spiritual, emotional.
Yeah.
That takes a lot of time. How do you do that with every patient that comes down the pike?
It's a challenge, obviously, and we don't do it fully every day. We never have done it completely fully this side of heaven, but we do try to tailor care in a way that works best for each individual patient, and not being on the insurance reimbursement grid for the most part. We're free to kind of tailor our services in a way that we think will will promote the most healing for the patient. So we're not quite as rushed in the visits. We started doing a lot of this individually as volunteers and then a few staff, but we've grown to the place where we have an interdisciplinary team of staff and volunteers. A primary care provider and a nurse are the most likely candidates to see a patient on any given day, but depending on the need, they may also encounter a social worker or a behavioral health consultant or a staff pastor or a pharmacist or someone who's going to help get patient drug assistance or set up a referral. So it really is a team-based approach to care, and that helps enrich that sense of touching on the whole person.
You must have a large team to provide all of those services.
Yeah, we've grown. We started, as I said, just volunteer only. I was the first full-time staff physician, but today we have a staff of about 45.
Wow.
And over 300 volunteers on site, another 150 or so off-site volunteers as well.
I feel like you serve kind of two different groups of people. You serve folks who need health care, and I think you also serve folks who provide health care.
That's a good observation. You know, Siloam functions in many ways like a bridge in Nashville. In some ways, it's a bridge between the healthcare professionals who are working in the regular institutions each day, but who get to come and participate in care for those who can't access their medical institutions. It's a bridge between old Nashville, those like me who grew up here, the few, the proud, the local yokels, and those who are moving here, not just from across the country, but from around the world. But you're right, one of the great gifts I think Siloam offers is a taste for healthcare professionals who are serving as volunteers or trainees who are hoping to develop a career in healthcare, of what healthcare could be like. Part of the language we use sometimes is we seek to ruin the next generation of healthcare providers by exposing them to a truly rich, interdisciplinary, and meaningful form of primary care that shows what can take place if you set your mind to it.
Yeah, my name is Dr. Brent Snader, and I am the lead staff physician and the Quality Improvement Director here at Siloam. I've been here for about 3 years, although I volunteered as a medical student and resident about over a decade before that. So people come from all over the world. We have patients from roughly 80 different countries, and they speak all kinds of different languages, so clearly have whole different ways to both see medical problems and how disease works in that kind of process, but just how they interact with one another and family and those kind of things. So it just really just broadens your perspective in so many ways. I love just the atmosphere that we have here at Siloam. We really try to create a culture where our patients feel loved, and we hear that a lot. And patients say that when they have to leave us, we only care for patients without insurance, and so sometimes we have to say goodbye to patients so we can make room for other patients to come. And a lot of patients will just say that they feel loved when they come here, and that's really what our mission is to share the love of Christ by serving those in need through health care. And so it's awesome when we hear that, but it's also to be a part of that as well, because I think I receive from the people I work with and from the patients that we get to see, because that's just they're just great folks that we get to take care of.
How do you embrace different religions? Because I assume Siloam is not about necessarily converting a patient into Christianity, especially because you serve international communities who come with their own experiences and their own beliefs. Tell me about the respect and the exchange that goes on.
It's a great question. We have patients, obviously, who come from all faiths or none, as well as dozens, hundreds of volunteers from a similarly diverse group of backgrounds. Ultimately, it's about love and loving patients in a patient-centered way. But we find that most of our patients, and research backs this up, are wanting their physicians and healthcare providers to understand and address the spiritual dimension of their illness situation. Wow. And because of the busyness and pace of the modern healthcare system, that often gets neglected. It's hard to measure and put on the bottom line. although sometimes by neglecting it, we actually jack up the bottom line. We fail to address the underlying motivational factors that are driving healthcare utilization. So the first thing we try to do is just create a safe space for the whole person to be seen. And that looks primarily like listening, taking a careful history that includes a broad social history, spiritual history being just a piece of that. And if you were to break down our patient population, they're probably a majority come from some type of Christian background. I think the 40+% who come from Latin America largely bring a Catholic or evangelical heritage with them. There's a significant number of Orthodox Christians from Egypt and Ethiopia. But then Muslims make up the next largest group, as well as a number of Buddhists coming out of Southeast Asia, Hindu, and many other religions that I've only learned about by getting to know some of our patients firsthand. So patient-centeredness, listening, trying to discern what the factors are in their health presentation where faith might be a factor. Many of our patients fast on a regular basis or seasonally around feast and fasting seasons in their liturgical calendar. That's very relevant as we're managing diabetes or trying to regulate a medication regimen. In other cases, it shows up in the way we manage stress. So think about the last time you were sick and harried in different ways. The way you manage stress is often a manifestation of your deeper commitments, your faith commitments. Prayer being a significant piece of that, but community. So how are people connected? Where is their source of support? So we need to know about those things and try and partner with our patients in that process of healing by connecting them to resources beyond just what we have in a prescription pad.
And you all serve, just to be clear, you serve uninsured, low-income citizens?
Don't have to be a citizen,
Okay.
just the uninsured and underserved who don't have access to health care anywhere else. So we will screen patients on the front end to see if they have access to health insurance that could be used at another facility, and if so, we'll try and refer them there.
Right.
But we want to be there for those who don't have anywhere else to go. There are a few minor exceptions to that related to some of our programs where we have continuity with some of our particularly refugee patients, but by and large, really being there for those who have nowhere else to go.
Tell me about, I think you have classes maybe for new Americans, a relationship perhaps with immigration services?
We have probably best way to think of it is about 3 programs that are designed to move upstream and address some of the particular needs of new Americans in Nashville. So we stumbled onto this population. We still see patients who are born and raised here, just like you and me, but about 85 to 90% of our patients are foreign born. A particular subgroup of those patients are refugees, and they come through programs that are subsidized by the State Department and other federal agencies, and then supported by local nonprofits as they make the transition. We provide a key program that ensures the health and safety of all new refugees in Tennessee. We oversee the medical screening for all refugees coming into the state. And we do about 70% of that work here in Nashville. And then we subcontract with clinics in Memphis, Chattanooga, and Knoxville to handle the refugee screenings in those cities. So that is a very time-intensive, volunteer-supported, and important program that we provide, but it really just affects those first month or two of a patient's arrival. Identifying if there's an important problem that needs case management, ensuring that vaccinations are up to date, that standard TB screening and things like this are taken care of. So really trying to ensure the healthiest transition possible for these newly displaced arrivals. Another program sort of picking up the baton from the refugee screening program is, we've called it in the past refugee health promotion, but it involves really trying to pair volunteers from the community alongside new refugee families and help them build their health literacy skills. And by that, I mean just awareness of
How to
how
navigate this crazy
our
system.
healthcare system works. And you and I struggle with that.
Yes.
Imagine having another language to deal with, a whole new culture, your children off in a different school system that you don't connect with them on a regular basis or understand how they would be cared for in the event of a high fever or a sickness. What is 911? When would I go to a clinic versus a hospital?
Right.
What is this insurance card? Many things like this, but we employ lay people, not paid employees, but volunteers. We put them next to some of these families, equip them, train them with some basic tools, and let it be a mutual learning. This is part of the bridging old and new Nashville that we talk about. And that really is focused on that first year or so after arrival. A third program that we've started in recent years is really targeted towards communities who've been here for at least a few years and are beginning to develop more of a self-sustaining ability to navigate healthcare on their own, but still need some help. And that is called community health outreach. And we employ community health workers from ethnic communities, right now just 4, the Egyptian, Bhutanese, Burmese, and Hispanic communities, and really equip them with time and attention from our nursing staff to go into their congregations, places of worship primarily to start with, and discern what the needs are and what the resources are that they have, and help collaborate with them to develop solutions that are appropriate for them. So it might be a campaign or education around mental health and suicide awareness, or a real targeted program on dental care and the need for preventive dental care and where to get more emergent dental care. It really just depends on the needs of the congregation or the community. So those are 3 programs that we have really developed, particularly targeted towards these vulnerable but high potential groups that show up at our doors.
Nice. I think you have a special relationship with Belmont.
Yeah, Belmont University, the College of Pharmacy, has a great program where they deploy some of their faculty into occasionally nonprofits like Siloam, and we've benefited from having Dr. Lisa Green has been a pharmacist from Belmont who spends the equivalent of 3 days a week on site and stretches that out over the week and brings senior PharmD students and occasionally residents as well to help augment our care, do education, medication reconciliation, both for patients and equipping of our staff team. So it's been a great in-kind partnership.
Very inspiring for the student, I would think. Similar to how you got in the family in the
That's
first
right.
place.
We're trying to ruin the next generation of pharmacists as well as doctors and nurses.
My name's Emily Locke. I'm currently here on a month-long rotation to learn under my professor, Dr. Green, just as training for my degree.
I'm Elisa Green, and I'm a professor of pharmacy practice at Belmont University, and I'm co-located here by contract at Siloam Health. So I get to spend about half of my time year-round here and bring students here to train under me and with the clinical team, and then we also get to serve our patient population here at Siloam all together.
I'm Anais Friday. I am a Belmont student. I'm a 4th year. I am here to train under Dr. Green and, just get to know the patient population that she serves.
We've gotten to see a variety of patients for different reasons, some warfarin monitoring and diabetes management. We also got to be a part of the refugee intake process, so we got to shadow families as they came for their first clinic visit since being in America. So that was really interesting and insightful for us.
Yeah, it's really fascinating, and it's one of the things I love most about being here is working with the immigrants and the refugees, because every day is something different, and although common things are common here just like anywhere else, there are also some really unusual things that we get to see that may not typically present at your normal family medicine clinic in the United States. So I've gotten to see leprosy and some kind of strange parasite infections and some other strange infectious diseases that are obsolete in the developed world, and so that's nice because it keeps us on our toes, and we always get to learn But then we also get to meet the patients where they are and know that they're transitioning their whole lives to be here oftentimes, and so we can help in ways that are outside of just, here's this medicine, take it, but more like listening to them and developing a relationship in somewhere that could be a safe place for them as they're learning what it looks like to be a healthy American.
A lot of our patients here, I think the 3 main languages they speak here are English, Arabic, and Spanish. So a lot of the patients that do come in, I do actually get to work one-on-one with them and, actually get to talk to them and communicate with them in the language that I grew up speaking. So it's really nice.
So I love getting to have students train here for several reasons. One is that the team is just second to none in the way that we incorporate students of all disciplines. I like to tell them when you're here, if someone asks you a question, they want your input. They're not testing you or tricking you, like you are valuable. And so that's really refreshing for the students. But then also just getting to experience the diverse things that come here is like nothing else. The whole person care aspect that Siloam purports is really true. It's not just in our mission statement or our vision here. It's incorporated in the way the team interacts with each other. And so I might be collaborating with several different specialists from several different areas of practice on a given patient's care, and we get to bring the students into that. And it's really exciting because we think what we do is great, but people are going to go out into the world and have jobs all over the place in different areas, and so we like to have the opportunity during training for people to develop those habits and mindsets that maybe will allow them to care for people better wherever they end up.
One of your taglines is healthcare transformed by love. I bet you've had some experiences that demonstrate that.
Too many, and our staff could tell you even more, but I know for me, one of the primary images of this was when I was just encountering Siloam for the first time as a young medical student. We were caring for a Vietnamese woman back in the days when the majority of our patients were Vietnamese refugees. And the attending physician and I performed a pap smear on a young woman, and she came back 2 weeks later to get the results. And as I matter-of-factly shared the normal results of her test, she broke down in tears and literally got on her knees in front of us and wept. And a minor miracle happened. The doctor and the medical student didn't say anything. But as we gathered ourselves and she gathered herself, we asked, why is this so emotional for you? And she told us that in Vietnam she'd been diagnosed with cervical cancer. Well, it dawned on me to ask, how long have you been in the United States now before you've had this test? And she said 2 years. And can you imagine living for more than a couple of years with basically a death sentence coming out of her context over her head? And she told us, when I asked her, why did you come here now? And she said she had just learned about Siloam and she heard that we loved our patients here. And so when I teach students about cross-cultural care, the key is really the golden rule. You may not know everything there is to know about another culture, but the way to overcome some of these significant barriers is by loving patients well. And that includes practical things like language and time to understand the problem, as well as sliding fee scales and affordability and open access scheduling. But there are significant barriers out there, and she reminded me in a powerful way just the simple value of love and how that transforms healthcare. But love speaks any language, and I think our patients have tasted that and certainly have given that back to us as well.
So, Morgan, we have one final segment with you, and it's my favorite one. It's the speed round. Just like the game we played when we were kids, I'll ask you a question, and first idea into your mind, just let it fly, and we'll go on to the next one.
So no phone a friend?
No phone a friend. Okay, ready? Speed round, with Morgan Wills. True or false? Healthcare is a complicated issue in America.
True.
See how easy this is? Should healthcare be dependent on citizenship?
No.
True or false? The average patient payment at Siloam is $17.
True.
What one word do you say more than any other word at work?
Love.
What's a prayer intercessor?
Someone who lifts up the needs of our patients and our organization to our Heavenly Father.
A term I had never seen before your website. That's very interesting. Thank you. What is the mark that you want Siloam to make on the world?
I hope Siloam connects people through love in a way that leads to the flourishing of our city.
And last of all, what's your website?
SiloamHealth.org.
Thank you so much. Great.
It's our Nashville.
It's our Nashville.